The objectives are to define public health. We're going to name 5 parts of the road to a public health career. Sorry, my little lion head is covering that up. And then we're going to define incidence, prevalence, and relative risk, and we're going to apply the mathematical formula. Does that sound good? Yeah, so are you guys familiar with incidence and prevalence?
Yeah.
Okay, so I heard a yes. That's good. That's good. That's real good. So a little bit about me. My name is Dr. Ashanti Carter, and I serve as the Director of Community College Partnerships at Charles R. Drew University of Medicine and Science. We're right in your backyard. We're located in Watts Willowbrook. I'm going to tell you a little bit more about us, but the title that I'm most proud of is that I'm a graduate of CDU. So I graduated with my master's in public health. That was back in 2014. I'll tell you a little bit about what I did. I am from South Los Angeles, South Central to be exact, and first gen college student. So funny story, I'm also a transfer student. So I remember I was at Antelope Valley College, first day of school, right? So I have on my watch and I'm sitting down outside of pre-calculus, 7:50, and I'm just sitting there like, yes, it's my first day of class. So look at my watch, it's 7:55. It's like, yes, can't wait to get started. Then I look at my watch, I'm like, oh, it's 7:57. Okay, I guess I'll go to class because I guess their bell is broken, right? So being a first gen college student, I was still waiting for the bell to ring. Not thinking that college, it's about being an adult. There were no bells, right? In some classes, there isn't even attendance. So it's up to you to advocate for yourself. So after Antelope Valley College, I transferred to UC San Diego. You can ask me offline about that experience. But then I went to Drew, worked at the medical school. Then once I left, I went to GW. So that's why you see that symbol right there. And where I worked at the Rodham Institute. Oh, yeah, it works. Cool. I worked at the Rodham Institute. So yeah, that's Hillary Rodham Clinton. And so I did a lot of work with her around health equity as it relates to education. So with my public health degree from Charles Drew, we're looking at public health as a whole. But as you know, with one of the social determinants of health, it is education. So I did a lot of work with that. Okay. And I was a teacher for a while. So it's great to be back at Drew. I can't. Okay, there we go. So a little more about Charles Drew. We're named after Dr. Charles R. Drew. He created methods for plasma transfusion, and he saved millions of lives during World War II. We're located in Watts Willowbrook. That's part of the Tonga tribe. And you'll probably think like willows. Yeah, Willowbrook, willows. They're actually used for anti-inflammatory medicines and all of that good stuff. So who would have thunk it that CDU is built on land that was used to heal people, right? And we're a health profession school. So we are a historically Black graduate institution. People say, well, Drew is the only HBCU on the west of the Mississippi. That is actually incorrect. We are not a designated historically Black college or university. We're a historically Black graduate institution because we missed that designation by 1 year. We were founded in 1966, right? So the cutoff was 1965. So we are a Hispanic serving institution. We're a minority serving institution. So we have our master's program. That's why, historically graduate school, but CDU has done something fantastic where we've established our undergraduate programs. So we have the Bachelor of Science in biomedical science, right? We have the Bachelor's of Science in public health, and we even have a Bachelor of Science in psychology. And for all of our bachelor programs, we admit fall and spring. So if you are graduating in December, good news, you can come to CDU, right? And I'm going to tell you why. There we go. It's because we have an articulation agreement with Long Beach City. This was signed a few months ago. So what does that mean? Well, it means that if you graduate with an ADT, an associate's degree, and you're ready to transfer, you're automatically admitted to CDU, pending you have actually completed your prereqs with satisfactory grades. Okay. You also get $1,500 per academic year. That's your grant, and of course, it's cut in between semesters, cut in half. And you have to be enrolled in at least 12 semester units. So the beautiful thing about the public health program is that, I'm gonna go back. We actually have the HRSA grant. And with Drew being private, you're probably thinking like, oh, y'all are real expensive, huh? Not so much. We're probably like a few thousand more than UCLA. But with that, I tell people all the time, you invest in yourself. So with this HRSA grant, it actually covers at least 60% of your tuition, right? At least 60% of your tuition. And they've done a lot of cool things. I know they go to Cuba every year. They go to the DR. I know they're planning a trip to the Dominican Republic to do a lot of things in public health. And so with Drew being so small, we have more opportunities and students. So tell you this. So with our biomedical sciences program and with other programs, right? They had it's engaging students in aging research, ESAR. And it was for community college students. So you guys can make $10,000. So it's $5,000 over the summer and then another $5,000 this fall. I actually came here to LBCC to recruit like students. So guess how many students we have in the program? 20? No, 6. And this was for 30 spots. 6 community college students. 6 for 30 spots. $10,000. And this is a free research program that we have partnered with UCLA. And I was here on your campus, actually twice, passing out flyers. Okay? So we do have opportunities. Okay, so what's public health? You've been in this class. What's public health? Oh, I don't like that laughter. Yeah, basic needs and steps to the public. When I think of public health, I think of prevention, right?
Give services.
Services that are needed. Yes.
Prevention and intervention in communities.
Yes, prevention and intervention in communities. Yeah. So at Drew, we actually have a medical school, right? So some of the MDs, well, the medical students, they'll, go into the public health program to get the MPH. I get a little salty at times because, public health is different from medicine. Medical students or doctors, they treat, right? They treat disease. With public health, we prevent, right? We intervene, we interrupt, we provide the services. Okay, so let me just talk to you quickly about the road to public health, and then we're going to get into the nitty-gritty. So you already know, graduate from high school, blah, blah, blah. You're here at LBCC. That's cool. So at Drew, we want you to maintain, a competitive GPA, because we have scholarships just besides the HRSA scholarship. There are more, right? So you need to have that GPA. And then for our master's program in public health, you no longer need the GRE. So when I was there, you had to take the GRE, right? And then be involved in extracurricular activities. So for us, we have the Public Health Student Association. Back in my day, it was called the Masters in Public Health Student Association. I was president. Because we have this articulation agreement. You know what that means, y'all? That means you, as public health students, get to work with our public health students, right? So your friends get to work with my friends. And even as faculty, your professor, he gets to work with our professors. So think about National Public Health Week, which is the first week of April, and we can do some things, okay? So you would apply. So let's say, all right, Dr. Ashanti, I'm almost done at LBCC. So you will go ahead and apply to your public health school. That's us, right? Because you're guaranteed admissions. So apply to the public health school. You know, you're at your university, Drew, or elsewhere. You do great, right? So then let's say you want to get your master's, which you should. So then you apply to a master's program, right? So you would be doing your great things at Drew. So going overseas, doing your research, doing all of those things, meeting great people. And then let's say you decide to do your master's at a UC or you say at Drew. You still want to do well, right? So what happens in your master's degree? In your master's program, you read a lot. You write a lot. You read and write, that's all you do. You read and write and do some research. That's all you do. Okay. And then after that, you can go on to your career, right? You can. You can if you choose to. Or you can be a glutton for punishment like me and decide to do a doctoral degree, right? And so for me, I'm at George Washington University. It's in DC. So after, where I went after I left CDU, and my degree is in higher education administration. So remember, I said education is a social determinant of health. So it's taken my MPH, learning more about education, and that's a beautiful, beautiful marriage, right? So you're probably thinking, but Dr. Carter, what did you do? What are you doing in your doctoral program? I read a lot. I write a lot. Yeah, so over 1,000 pages, right? Yeah, over 1,000 pages a month. Yeah, well over 1,000 pages a month. And then once you graduate, so I'm like this close to graduating. So my paper so far, my dissertation, I think I'm at 115 pages. So it's, yeah. Oh yeah. Over 115 pages, and then you have your oral exam, and then you're done. But the beautiful thing is that with your salary, with the master's program, if you do what you need to do, you should be coming out making $85K. For your doctorate, if you do what you need to do, you should come out making at least starting at 100. Okay? You have to network. And the jobs are out there. So what does public health entail? So I like to tell this funny story with one of my mentees. She graduated from Drew as well, but then she went on to Harvard, right? And so it was like, oh man, I want to go to Harvard. And so I tell people, well, we actually learn the same thing in our classes. The only thing is I went to Drew, she went to Harvard. I mean, same thing. There are core classes that you have to take. You have to take biostats. You have to take epidemiology. There are others. The difference is the branding of the school, right? So you think Harvard. I can tell you I ran circles around her, but she graduated from Harvard. So core courses, you have your practicum. Everybody, yes, that's my sense of everybody has a practicum. You have your electives, right? So if you're interested in health disparities, that's CDU, that's all we do. So you have those classes. And then of course your exams. So CHES, Certified Health Education Specialist, right? Your GRE, some schools still require that. So even with an MCHES, so if you want to go into health education, a lot of jobs require that, okay? They want you to take that test. So then your licensure exams, if you're going to health and safety, microbiologist, chemistry. It's basically, this slide is to show you that you may think, oh, my exams are over. Yes, no. Even when you go to medical school, you still have to take exams. Even when you graduate from medical school and you're in your residency, you still have to take exams, okay? So Get ready. So let me show you some money. This is an old slide, but basically it's to show you that the higher up you go, the more money you make. Right? So to be a manager, all of that, the higher up you go, the more money you make. This was, so for epidemiologists, they make more. They're like in the 80s, some of them in the hundreds. I know on the East Coast, hundreds of thousands. And that was due to COVID, right? So epidemiologists, what does an epidemiologist do?
The study of how disease spread.
There you go. Study a disease. There you go. There you go. It's not word. Okay, there we go. So incidence and prevalence, this happened actually during COVID. So Google, they show public health some love. So I borrowed that little graphic. So it's mine. All right, so incidence. It refers to the number of individuals who develop a disease over a specific period of time, right? So these are your new cases. Am I right or wrong? Okay. And there is a mathematical equation, the number of new cases over the population of the start of the time interval. This is a ratio. Okay, take a picture of it because it's gonna come back, right? Prevalence, it refers to the total number of individuals in a population who have a disease or a health condition at a specific period of time, and it's usually expressed as a percentage of the population, and sometimes whatever. Usually when you see it on the news, you know, it's a percentage, so it helps lay people understand. In my studies at Drew, we really didn't do percentages. I don't know what you guys do here. So yeah. So with prevalence, it's old and new cases. Okay. Incidence, new cases. Prevalence, old and new cases. So when they're talking about, oh my gosh, COVID, it's spreading again. This many people have it. They're talking about prevalence, right? If they start talking about, oh, this many people are in a hospital, this just happened, that's incidence. Okay. Does that make sense? Yeah. Now it sounds good, huh? I'm like, man, I'm learning that. Okay, there we go. So let me just give you a little warm up. So I'm a student, went to Cardi B's concert in her town. She heard someone say that the concert was sold out, which meant that there were 50,000 people in attendance, right? It's your population. She heard on the news that there was an outbreak of mononucleosis, or mono, and 1,000 people had the disease. Days later, it was reported that there were 15,000 more cases of mono, all traced back to the Cardi B concert. So calculate the incidence and prevalence of the disease. So I just gave you some data. You already know your population is 50,000. So she had just heard about that 1,000. So that's your incidence, right? So 1,000 over 50,000, 0.02 or 2%. And I made up these numbers because that's kind of high. You know, being at a concert, 2% of people caught mono, that's like real high. Okay. So then the prevalence, so it's your 1,000 plus 15,000. So it's your 16,000 new cases and old cases. Divide that by your population. So it's 0.32 or 32%. Okay. Does that make sense? And that should look familiar, doesn't it? Okay. All right. So I'm on to something. Okay. So relative risk or risk ratio, you guys have heard of that, right? Yeah. Okay. Okay. So it compares the risk of a health event, right? A disease, injury, risk factor, or death among one group compared to the other. And so the groups are differentiated by demographic factors, men versus women, right? Exposure versus non-exposure. So smoker versus non-smoker. If you smoke cigarettes, hey, I'm making this up, okay? So don't be like, oh, Dr. Carter said blah, 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 blah. No. So if you smoke, your chances of getting lung cancer is like 4 times greater than someone who doesn't smoke, right? So that's your risk. So what's the health event? Your cancer, and so also you smoking, which causes the cancer, right? And so they do the same thing with like eating unhealthy food. Me, I'm a chocoholic. I love chocolate. So eating chocolate, you don't exercise, right? You can end up getting diabetes. So that's your relative risk. Does that make sense? Right? Or even looking at grocery stores. So have you guys done like an assessment of certain service planning areas, especially with food? Don't be shy. We're all family. And if you say like, oh, I haven't done it, I'm not gonna like jump over there and scream. No, you should. So look at the food deserts, service planning area 6, SPA 6, which is Watts Willowbrook. Compare it to service planning area 5, which is West LA. Look at the food. Look at what's on the corner, right? What do you think you would see in Watts or even certain parts of Long Beach? If you looked at the grocery stores, what kind of food am I gonna see?
Junk food.
Say it loud so everybody can hear.
Yes, junk food, cheap junk food that's bad for you.
There you go. Cheap junk food that's bad for you. So
food that's gonna be banned now. Skittles.
Right. Right. Huh?
Hot Cheetos.
Exactly. Because even though I love the movie Flaming Hot, didn't they say like that? Dust, it man, leads to some.
Once it got commercialized.
Yeah, leads to some bad stuff.
Oh, sorry. Have you been?
Huh? I was frozen. Oh, okay. Sorry. Okay. It leads to some bad stuff. Colon cancer because of how it irritates the lining of the stomach. Right? The red dye and Skittles, all of that leads to like stomach cancer. Right? But in our neighborhoods, they just pump that up. I know, okay. So then looking at West LA, Santa Monica. I used to live there before I moved to Baltimore. So Santa Monica, I saw farmers markets, I just saw all Whole Foods. I call it whole check because you go in there, spend your whole check, right? So you see all of that in there. So just look at relative risk and it's all around you. Public health is all around you, okay? So the formula is the incidence of the exposed group divided by the incidence of the unexposed group. Okay, so y'all ready? Ready to do some work? All right, how am I looking on time?
11:30.
Okay. There we go. So here we go. I'm fancy. All right, so we have our matrix there. Does this look familiar?
Yeah.
To calculate relative risk? Yeah, I mean, we all do it a little differently, but the gist is that, right? So looking across, we have sick, well, our total, and our cumulative incidence, right? So that's going forward horizontally. Vertically, so that's like our x-axis. So then your y-axis, you have your exposed, unexposed, and your total. Yes, I was a math teacher. So then in this quadrant right here, we have A, B, and then your total A plus B, which is H1, and then your cumulative incidence, right? So it is your cases of people who are sick, A divided by your total. So A over H1. Right? So then for the unexposed, we have C, they're unexposed and they're sick, right? Then D, they're unexposed and they're well. So your total C plus D is H naught. So then C divided by H naught is your cumulative incidence. So then your grand total is H naught, B1, B naught, right? So totals, A plus C, right here, easy. B plus D, right there, right? Grand total. And then your relative risk is that divided by that, right? So whatever number it is divided by that. That's your relative risk. Easy, huh?
Yeah.
Yeah. Yeah. Okay. Yeah. Yes, next slide. All right. So relative risk is less than, right? So looking at our little alligator mouth, it's greedy. So it's eating a 1, but you turn it up, looks like an L. So this is a reduced risk, right? So if I exercise more, I have less of a chance of developing cardiovascular disease. Does that make sense? Right? Reduced risk. So remember our little alligator mouth is greedy, so it's eating the relative risk. So we have an increased risk of something happening, right? So increased risk, I'm smoking, right? There's an increased chance of me developing lung cancer. So then relative risk is 1 or close to 1, there's no difference. So I exercise some of the time, but I still like to eat my chocolate bar. I'm not eating 5, I eat 1 chocolate bar. Well, I mean, it's not really making a difference. You're eating a chocolate bar, you're exercising, and you're drinking a Diet Coke. I mean, you're not gonna like be a size 0. Okay, so that's not, no, it's not gonna happen. So you need to pick one, okay? So next slide. So remember those numbers. So let's talk about the curious case of Eppington. All right, next slide. So Eppington, USA is a small rural community with a population of 100,000 people. So I'm giving you data. On July 5th, Eppington Memorial's emergency room is packed with people complaining of a painful rash and blurry vision. The doctor on call calls the Eppington Public Health Department to get to the bottom of this curious case. You are the public health professional. You conduct interviews and found that the patients were exposed to a heavy metal in the water of a certain community in Eppington. Examining the case, you found that 100 of the 200 people living on Contagion Road developed a rash and blurry vision. You also found that 50 of the 200 people living on Healthy Way developed the same rash and blurry vision. Calculate the relative risk of those who contracted this illness. And what are your recommendations of Eppington regarding the residents living on Contagion Road? So let's go. So that's how it should look. You have 2 minutes to figure out the rest.
Where?
You're filling in the table.
Draw the table.
Draw the table.
Draw the table out.
Yep, I already gave you some data. So you're calculating everything else. You're calculating the relative risk. So what time? What time now?
11:44.
11:44. 5 minutes. I'll do 5 minutes. I told you were gonna have to do work. You didn't believe me? Stop a shame. So 5 minutes. I'm passing you out a survey. I'll collect it at the end, guys. Here you go.
Yeah.
How are you guys doing? You using your algebraic skills? Yes, sir.
Just making sure when you calculating it, we are using the total population overall, or is it the well population for funding grants? Cause like we define like our
Your
six.
total here
So, alright,
and total here.
thank you.
Uh-huh,
We go back some time.
yeah, you can go back. Mhm.
So that's the.
There you go.
Yeah, that.
Mhm. Can I give you one? Did everyone receive the survey?
See, I'll take a picture of this. I'm gonna go back to the blank one. Okay? So take a picture, share with each other. Got a partner, what's your partner? Whoever have your phone, take a picture and let's share it. I'm gonna go back to the other slide. Alright, got it? Great. I'm going back to the other slide now. These transitions.
Yes.
Transition. So yeah, he said, I get it.
Yeah, I. Okay.
I got some. You got some over there. Alright.
How are we doing?
We're good. Sorry, it's 47. Let's see. Almost 50 minutes.
All right. So, what do you have for, so we're looking at Contagion Road. How many people are well on Contagion Road?
100.
I got you.
Okay. Yes. Yay. All right. How many people are well on Healthy Way? All right. What's my total for
What is it, 8?
no, I'm looking at for my sick.
Sick.
Oh, 150.
Okay. For my well, huh? Okay. What's my grand total? For shame. I told y'all it was this plus this plus this, your grand total. What's my incidence for cumulative, my cumulative incidence for Contagion Road? Let me see. 0.5, 50%. Because I took my cases of people who were exposed divided by the population. That's how you do that. For Healthy Way, what'd you get?
4.
Good. Let's see. So it's 50 divided by 200. Yeah, there we go. Divided by 200.
So some of y'all are adding across. It's supposed to be for this last year, it's supposed to be divide out.
Yep.
For the sick over total.
Yep.
That's the mistake we're making.
Yep. Remember, I said they're ratios, fractions, dividing. So what's my relative risk?
Drum roll, please.
Oh, yeah. What is it?
So we got
2. Right? Because it's 0.5 divided by 0.25. You have a dry erase?
Got you right.
Okay.
Yeah.
Let's do black. Okay, so let me do both. Okay. Okay, so 0.5, that's a half, right? Divided by 0.25, that's a fourth, right? So 1/2. Even if I did it by hand, times
Yeah.
this
Cause we.
flips 4 over 1, 2 and a 2, 1, 2 and a 4, twice, 2 times 1 times 2, 1 times 1, it's just 2. Okay, that's how you do it by hand.
Come through with that math.
Right? That's how you do it. Okay? Sorry. Okay, so your interpretation should be residents living on Contagion Road are 2 times as likely to have heavy metals in their water compared to residents living on Healthy Way. That's the interpretation. What would you say to the mayor? Remember, you're the public health professional. What would your recommendation be? You see if there are heavy. I heard a voice. Okay.
You need to start checking the water in Contagion Road to find out if there are heavy metals, and then you have to trace back to where those heavy metals are coming from and stop them.
Come through. Yes, that's right. So that what is that? Right? So something has to be done to investigate the pipes or even the water source. Yep. And we go to Flint. That's actually what happened though. So Flint, African American population, lower income, right? Lower resource communities. This is Detroit. They switched over their water systems. And then this is the pipes. So lead was in the pipes. What's the significance of lead? Oh, okay. It's poison. But who in here wants to be a doctor? And nurses. Okay. So what is the what you say? What is it?
I want to be something.
That's what I'm talking about. Yeah. So, with my future MDs and nurses, what is the significance of lead?
Well, it causes nerve damage.
Why?
Tuberculosis.
Why does it cause nerve damage? It crosses the blood-brain barrier. So, with a lot of kids drinking the water, this is a public health issue. You're gonna have children with neurological issues. Okay? People bathing in the water, there's dermatological consequences. Right? So this is why Flint, this is still going on. So I think their governor got arrested. Yes, the governor got arrested because he knew and didn't tell the people. He poisoned all of those. Huh?
They literally dumped all the turkey.
What?
Yeah. Against both.
Against both of them. Nobody got arrested. Nobody did time into that. They're all free of charge.
And then they had a new investigation.
Okay, so the new investigation. Okay, because the last I had heard, like he was scared.
And they're not using any of the recent last case, with their trying, because they said that was faulty investigation. So,
Interesting. So for you guys, statistics and all of that, it can be used to do something, to do bad things too. Okay, all right. I'm gonna keep going. Okay, yeah, next slide. Huh?
No,
Okay. Okay, so let me pause right here. Whoa.
who's the side comment? Sorry.
Oh, okay, all right, sorry. Okay, so yeah, so let's do this. So in my last few minutes, right? So how many of you guys have learned about structural racism in your public health class? Okay, what is it?
So it's kind of in a community or in like a large, in a community, you've got a system that the community is running on is built upon racism. So you've got kind of a separate, like a health disparity between certain races in this community because of how it was built.
Yes. So the significance of this slide is that you see the hand coming down and there's a Lego. So my little brother, he loved to play with Legos. built people, built communities, built cars, built a little version of me. Oh, that's you. So I'm 14 years older than my brother. So, you know, it's like, okay, great. So structural racism is the same thing. It's the building blocks of our society, right? It's built into our language. Have you ever heard somebody say, man, they live in a bad neighborhood? What kind of neighborhood were they talking about?
Oftentimes low income.
Right? And so we say lower resource, right? So it's a lower resource community. And you see how I flip that because low income, remember I told you, I was born and raised in South Central Los Angeles, 2-parent household, middle class. Nobody ever broke into our home. When we moved to Palmdale in the suburbs, somebody stole our lawnmower. Somebody stole our lawnmower. We're just like, why are you? It was a real, because my dad's a landscaper. So real nice lawnmower, they stole it, right? So even living in Santa Monica, people would say, well, Dr. Carter, you and your husband lived in a good neighborhood. I can tell. Who said that? A great neighborhood? But what if I told you that my neighbors, true story, because I'm nosy, everybody's talking loud, right? So I'm like, ooh, what they saying? So then I go like step in the bathtub and I open the window so I can hear clearer. Homeboy was talking about starting a new gang in Santa Monica. Yeah. Yeah. He wanted to start a new gang. So he and his guy, they were talking. And I'm just like, I tell my husband, come here, listen. So he was just like, whoa. So believe it or not, in Santa Monica, they had a gang problem. Yeah, they had a gang problem. Yes, there's subsidized housing in Santa Monica. Yes. But where we live, right? So subsidized housing, the neighbors, they were paying like $200. And we were like right by the beach. $200 a month and we're paying, right, X amount. So with our language, we have to be careful what we say and the things that we believe about certain groups of people.
From my understanding, because I'm from South Central, but both places that are suburbs are the most likely to get robbed because they like to leave their doors unlocked and they have no valuables.
Yeah. And then when we talk about a crime-infested community, it's due to poverty, right? If I don't have it and you have it, I'm gonna take it, right? So one thing about me that you didn't know is when I was a teacher, remember I said, oh yeah, I taught math and science, but my students were incarcerated. So I taught for our LA County Office of Education. We're going to the camps every day. And yeah, I was the only one there. And I taught boys. I refused to teach the girls because we can be vicious. So, you know, it was just me every day by myself with 17 young men who were probably the size of your professor or bigger. So yeah, so it's a lot of respect building, a lot of that. But when you hear about the things that my former students were incarcerated for, how do you get locked up for 6 months for stealing some candy? Like literally. How do you get locked up for 9 months for stealing food because mom is having some issues with substance misuse? You see what I'm saying? So we have to get to the root of the problem, right? And not just putting a Band-Aid on it. So that's what I mean by structural racism. Yeah. So with white supremacy, we already know about the covert, right? Hail Hitler, you know, doing whatever. But then the overt, then what about the covert? This is where we have to be careful, even in our field of public health, like with language that we use. Right? Underrepresented. I hate that word. I hate it. Well, you know, Black and brown people, they're underrepresented in medicine. No, we were historically excluded. Pardon me. historically excluded. There were laws that were put in place that purposely excluded Black and brown people from participating in certain areas in education and in their career. That's why in medicine and healthcare careers, you look at our profession, there is a professional disparity. That's why I'm getting the degree in higher ed administration, because it shouldn't be. Applying to medical school, I think Black doctors, no, Black medical students, 5 to 6%, right? Latinos, like 6, a little bit lower, right? Everybody else a little bit higher. And there's a reason why. So we are not underrepresented. We have been historically excluded. So we have to watch how we use our language, right? Next slide. Okay. So equality versus equity. There's one where you have the kids like eating the apples, and there's another one. I like this one, right? Because nobody, absolutely nobody should have to reside in a community where they don't feel safe, right? When I lived in Virginia, because I worked in DC, yeah, I wanted to be safe, right? Had to pay a little bit more. But if you know about, okay, what's the significance of Virginia? This is history. What's the significance of Virginia? Let me see what you learned in good?
Yeah.
Okay. The significance.
Well, I believe it was where the Pilgrims first lectured, right? Or is that Plymouth Rock?
Wasn't it?
Huh? Virginia was the capital of the Confederacy. Virginia was the capital of the Confederacy. So, and if you know the Confederacy, North versus South, right? Right, battle over capitalism, money, part of the chattel were enslaved bodies, right? And of course, free labor of Black, brown, and other BIPOC people. So with that, living in Arlington, Virginia, yeah, it was great. But I could go to other places and see stuff like this. Even living in Baltimore, because I didn't tell you this also, I worked at Johns Hopkins. So after I graduated from Drew, I was recruited to work at Hopkins. Hopkins is an Ivy League school.
That's like
There you go, and I worked there. Thank you. And good for y'all if y'all can do Drew. So being there, I lasted 8 months. I left. I hated the culture because when he said, man, it's one of the best medical schools in the country. Yes. But when you see the people living around there who have the worst health outcomes in the nation, that's disgusting. And if they have a $1 billion research portfolio and you're not doing anything to help the people that you're raping and pillaging from to get your grants, I don't want to support you. I don't want to work for you. I'll take my talent elsewhere. So you have to have integrity. Next slide. Yep. Okay. So I'll end with a couple of quotes. Education is our passport to the future, for tomorrow brings to the people who prepare for it today. I like to travel. So if you have your passport, you already know. If you don't have your passport, they are not letting you into that country. Period. Don't care even if your parents were born there. Your education is the same way. If you don't have it together, they're not going to let you in. Right? So you're here at LBCC. You have a wonderful professor. LBCC is a great school. We have a wonderful partnership. Even before the MOU was signed, when I was working at Drew in the Office of Admissions, I was always here recruiting because you guys are great students. You guys are what we need because you guys make us better, right? So next slide. I love this. This is actually on our campus, and I did not know that Dr. Drew said this. He said, excellence of performance will transcend artificial barriers created by man. So what that means is when people tell you you don't belong here, that's an artificial barrier. That's a lie. You do belong. God bless you. You can perform and just outshine and outdo everybody else. It's an artificial barrier. Don't share your big ideas with small-minded people, guys. You got this. Don't let anybody tell you what you cannot do. You can do it. Next slide. So keep in touch. There's my email address. And with that, I'm done. Any questions? I'm done.
I also have some things over here as well for the public health for transfer associate science degree. Some of you have been asking what exactly some of y'all have been asking what exactly is needed for that. So intro to public health, which is this class right here, HLE 21, that's one of the courses. Another course you need is our contemporary health issues class. So if you take those two classes plus the core requirements of human anatomy, contemporary biology, general chemistry, human physiology, intro to psychology, and elementary statistics, you can be eligible for associate's and transfer degree in public health. Another thing, I don't think you mentioned your bachelor's program, the three different bachelor's programs that you offered. You did? Oh, I missed that part. Sorry. So yeah, the great. Yeah, please.
Okay, so we have the Bachelor of Science in Biomedical Sciences. So for those students who want to go to medical school, that's actually the best program. Don't let me, for you to, apply for, because it's not only academically rigorous, but you will take all of your science prereqs for medical school. Okay. So once you graduate with your Bachelor's of Science in Biomedical Sciences, you'll be at a crossroads. So is it research or is it medical school? And then it's up to you, because you'll be prepared for either one, right? So the Bachelor's of Science in Public Health, if you are just public health, you can do that. But also, I believe they will allow you to take some of the biomedical courses, okay? And you guys, we do have the College of Medicine that's there. So if you're at Drew, you do well, they can end up interviewing you. So lots of things. So we do have our virtual open house, which is next Saturday. So please sign up. Get more information. And we have our nursing school. So the RN to BSN, you're here at LBCC for your prereqs.
Yes. So just with that, I would like to say thank you everybody for showing up today. This video will be available. If you're in my class, it will be on the campus shell. For everyone else, it will be on YouTube at the LBCC Public Health YouTube page. I'll also be posting it on the LBCC Public Health page. So that's just at LBCC Public Health, both for the YouTube and for the IG. And with that, have a rest of the day, y'all.
Thank you, everybody.